Hi everyone. As we go into the section in this chapter about community versus individualism, I want to talk just a little bit about the idea of how COVID-19 is the perfect example for the idea of a collective action problem. Now, if you remember, a collective action must result in a public good that cannot be excluded from anyone. So if a public good is provided, everyone must have equal access to that good and be able to receive its benefits without additional cost. So for instance, public roads and interstate highways. Not all of us pay taxes for the use of these roads, but since they're all public goods, no matter what, we usually can't be excluded from their use on the basis of whether or not we paid our fair share of road and bridge taxes. COVID-19 has become pretty much the same, with the same problems that we have seen in other collective action cases. Since the solution to a collective action problem is to act as a group, and the benefit of a group action and group cohesiveness is the primary reason that the public good can be offered or should be offered, it's the group benefit that best describes the types of problems. But in order to benefit from a public good, a cohesive group is a basic requirement. This is where your author's discussion of solidarity comes into the picture. I'm sure all of you have experienced a situation where you've been in a working group or a group at school and you're trying to work on a problem, or you have an assignment and only one or two people really do the work while one or two other people sit back and do as little or nothing as possible. Yet they expect to receive the same rewards and benefits as you. These people are what we call free riders, and COVID-19 definitely has a free rider problem attached to it. Now, I'm sure you know that the solution at this point to COVID-19 is, at least in the short term, actions such as wearing a mask, social distancing, shutdowns, self-quarantining, hand washing, daily hygiene, and getting vaccinated. And for most of you who are young and healthy, there's really a good chance that if you get COVID, you probably won't experience more than the symptoms of a flu or cold. But if you're diabetic, or if you're susceptible to viruses, or have a compromised immune system, or if you're elderly, then there's a greater chance that it will affect you, and a far greater chance that it will put you either on a ventilator in the hospital or in a casket. And that's the sad part to this pandemic. We learned very quickly that not everybody has the same risk. And we started to work as a community to socially distance. We shut things down. We worked from home. We had our children distance learning. But then things just started to get to a point where everybody got bored with that. And they started not to care whether or not somebody else's grandma got hurt, or grandpa, or sister, or brother, or friend. They were only worried about themselves. And that becomes what economists and political scientists call the free rider problem. These are people who have opted either not to wear a mask, or they have undertaken political protests so that they don't believe in vaccinations, or that they're being forced to do something against their will. They stand on the claim that they have liberties. Yes, we all have liberties, but when it's something is in the public good, do we have the freedom to say no in order to benefit ourselves and to place others in the community at harm and risk? That becomes the problem of a public good. The reason I say that becomes a problem is because the only solution to a collective action problem is for the people to work together so that they can receive that maximum benefit that a collaborative solution can offer them. But the enticement to the individual is to maximize their personal benefit and sacrifice the benefit of the group. And that's human behavior. I'm going to take care of me and mine before I help you take care of you and yours. That's how people work, and that's unfortunate. So you'll always have a free rider problem. So how do we get around the free rider problem? Well, one way that we do that is by providing incentives and punitive actions. We've seen that COVID-19 has this as well. For instance, we've seen positive incentives that say if you get your immunization, then the state, the county, or even the city will enter you into a lottery, and several states have had big lotteries, and people have won like $1 million because they got vaccinated. So we can give incentives, and that's a positive. But we can also penalize behavior, and that puts the public at risk. And that becomes even more of a problem, because when people stand up and say, hey, I have been punished for exercising my rights, someone can get a ticket, for instance, if they're not wearing a mask. But right now, a number of states, especially southern states, and Texas is among them, believe that it's impossible for a neighborhood, a city, or a county to make any rules regarding COVID that they don't agree with. And if they're going to require masks, or they're going to require that people be immunized before they go into the movie theater or anything like that, the state will step in and prohibit them from such actions because they say people have rights. But again, this is a really tricky subject when it comes to people having rights. My rights end when your rights begin. You have the right to life and liberty and property, just like I do. So either we work together and protect everybody's health, or certain people are going to end up on the losing side of the lottery here. So I'm going to leave it at this. I had a good friend of our family who passed away back last June, and he was immunocompromised and had been on a ventilator for quite some time. They took him off the ventilator, and within 24 hours he was gone. He was in his early 40s or mid 40s, and he was not an old man. He was not one of the elderly. This is not grandpa that you were going to throw under the bus. But why should we throw anybody under the bus? That becomes the question. And I'm going to leave you with that question as we go into the rest of our chapter, and then you'll see it in the discussion at the end of this chapter.